It's a problem that affects millions of Americans. Heartburn, easily treated with medication. But tonight, Dr. Mallika Marshall has a warning about a potentially dangerous side effect.
Grace Techman has now been taking heartburn medication for 9 years.
If I don't take it, the acid backs up and then I have severe heartburn and the ball in my throat.
Her relief has come from a group of drugs known as Proton Pump Inhibitors. They're excellent at controlling the symptoms of heartburn by reducing the amount of acid produced in the stomach.
Many of these medications started off as prescriptions in the late 80s and recently became over-the-counter. Doctors are now able to evaluate the long-term consequences of taking these popular drugs.
We've seen things like osteoporosis, vitamin and mineral malabsorption, such as magnesium, calcium, interactions with other drugs.
People who take these medicines twice a day or for more than a year have a higher risk for broken bones. Fractures have been seen most frequently at the tip of the thigh bone and the wrist. While the pattern suggests these so-called PPIs play a role and can affect body chemistry in a way that can lead to bone loss, a study to show a direct link has not yet been done. Still, concern about chronic use is growing.
Once you have gastroesophageal reflux disease, it is a progressive disease. If you've been on them for 5 years and you really don't have an endpoint and your lifespan's another 30 years, you have to ask yourself, what's the endpoint?
Patients can consider medicines that coat the stomach, drugs known as H2 blockers, or surgery. Grace is now mulling her options.
If I can fix a problem and not take the pills, I think it would be better off.
Now, some behaviors like eating a big meal and then lying on the couch can make heartburn worse, as can certain foods like chocolate, coffee, alcohol, and anything that's extra spicy. I'm Dr. Mallika Marshall, WBZ News.